Well, up first, let's take you through the latest numbers on coronavirus and cases that were reported on Monday. 2,22,315, down by 7.7%. Deaths reported were 4,454. Deaths were up by 16%. Tests that were done were over 19.28 lakh. The positivity rate is 11.53%. So the positivity rate has gone up by 1%. Vaccinations that took place in 24 hours, over 9.42 lakh. That's just not even 10 lakh vaccinations in a day. Remember, most experts say India should be vaccinating between 60 to 80 lakh a day if we're to vaccinate a sizable portion of our population. Remember, India also crossed the 3 lakh death mark. Almost 1 in 3 deaths took place in May alone. Now, in the last 2 weeks, deaths have risen at 13%. They're rising very rapidly in 20 states and union territories. In 9 of these 20 states, including Tamil Nadu, Kerala, Assam, deaths have risen by over 100%. In 11 other states, the increase in deaths is between 25 to 100%. However, in worst hit Maharashtra, it's 15%, while in Delhi and Uttar Pradesh, the number of deaths is contracting now. Now, in Bengal, 9 days into the statewide lockdown, COVID infections dipped below 18,000 in the last 24 hours for the first time in 19 days, though North 24 Parganas district remains a hotspot, accounting for almost 1/3 of deaths. In all, 153 people lost their lives in the last 24 hours in Bengal. The toll in North 24 Parganas was 47. And statewide positivity continues to climb up to 10.72%. A fresh worry is black fungus infections. 12 cases have now been confirmed in the state. 2 of the patients died in private hospitals. 6 of the 12 patients are COVID or post-COVID patients. Now, some vaccine makers have refused to deal with state governments regarding the supply of COVID vaccines. Remember, some state governments have actually floated global tenders. Now, the Kerala Chief Minister Pinarayi Vijayan has written a letter to the Prime Minister saying that the central government should procure the supply. The Chief Minister also said that vaccines procured should be distributed free of cost to the states. In the letter, Mr. Vijayan said the universal vaccination drive is the only way to achieve herd immunity against coronavirus disease in the long run. In fact, let's just take a look at the one of the big causes of concern, as we said, is the vaccination rate, which is very low, down by 14% in 24 hours. Daily vaccinations is 57% less than the daily production. Daily doses produced are over 28 lakhs, while the daily jabs are 12 to 13 lakhs being reported across the country. So a big difference there in the amount of doses that are produced and those that are given out. Now, states and union territories like Karnataka, Tamil Nadu, UP, Delhi and even Mumbai have put up tenders for over 155 million doses, but not been able to secure. Delhi and Punjab governments have now said that Pfizer and Moderna have refused to supply to states. Here's a report on India's failure to import vaccines.
On the 1st of May, the centre said state governments should go ahead and import COVID vaccines separately. Since then, states and union territories like Karnataka, Tamil Nadu, Uttar Pradesh, Delhi and even Mumbai in Maharashtra have put up tenders for over 155 million doses. But this has largely been a non-starter. For one, states like Punjab and Delhi have been rejected by Moderna and Pfizer, who have reportedly told the governments they'll deal with the centre.
हमारी Pfizer से बात हुई, फाइजर वाले कहते हैं जी आपको नहीं देंगे, हम केंद्र सरकार से बात करेंगे. हमारी मॉडर्ना से बात हुई, मॉडर्ना वाले कहते हैं जी हम आपको नहीं देंगे, हम केंद्र सरकार से बात करेंगे.
चाहे फाइजर हो, मॉडर्ना हो, हम उन सबके साथ सेंट्रल लेवल से कोऑर्डिनेट करते हुए उनको 2 तरीके से फैसिलिटेट कर रहे हैं. एक तो उनके रेगुलेटरी फैसिलिटेशन इन टर्म्स ऑफ अप्रूवल्स, दूसरा प्रोक्योरमेंट रिलेटेड फैसिलिटेशन. और बोथ फाइजर एंड मॉडर्ना, most of the time their orders books is already full, so it is depending on their surplus how much they can provide to India. They will come back to Government of India and will ensure and facilitate.
Several other states, including Assam and other governed by the BJP or BJP allies, are reluctant to do so.
I don't think these global tenders all are, I don't know whether it has any value beyond publicity, because when government of India is not getting vaccine, where from other company will give you in global tender? I don't think that I am basically observing the situation. Other states are floating.
आप ग्लोबल टेंडर के बारे में थोड़ा और जानकारी ले लीजिए कि यदि किसी ने प्रयास किया है तो क्या परिणाम आए।
यानी कि आपको लगता है इसका कोई फायदा है?
मैं ये नहीं कर रहा, मैं कह रहा हूँ आप पता कीजिए यदि किसी ने प्रयास किया तो उसके परिणाम क्या हैं।
Of the over 155 million doses sought, Mumbai has made some headway, with Sputnik suppliers putting in 3 bids for 10 million doses. However, states like Uttar Pradesh, which wants to import 40 million doses, has had to extend the deadline.
Uttar Pradesh, which floated the global tender first on the 4th of May, has now been forced to revise the timings for the opening of the technical bids of the tender by 10 days to the 31st of May. The state has also revised tender conditions like the storage and transportation of the vaccines in a bid, sources say, to attract companies like Pfizer and Moderna.
Another badly hit state, Karnataka's deadline ends today.
Today is the last day for the global tender. Let us see what is the response. Depending on the response, we just reached out to the entire world.
While the government has set a target of vaccinating the adult population by the end of 2021, the current rate of vaccination shows the target can be achieved only by the end of 2023. With Maya Sharma, Alok Pandey, Manish Kumar, Ratnadeep Chaudhary and camera person Manu Nair, this is Arvind Gunasekar for NDTV.
Well, even though there's a vaccine shortage, the government is now allowing walk-in registration for the 18 to 44 age group. Remember, till now they had not been allowed, but the government has said that people in that age group who are without access to internet or smartphones can now walk in for help to register on the CoWIN digital platform and get appointments and same-day vaccinations for a few beneficiaries. However, the centre left the decision to allow on-site CoWIN registration for either reason to individual states and union territory governments. These decisions, the centre said, can be based on local context. Now, India's most populous state, Uttar Pradesh, faces an enormous challenge of vaccinating its population against COVID in the shortest possible time. While the state was the first to go in for the global tender to procure vaccine doses independently, it has already been forced to extend the tender deadline by 10 days. Alok Pandey reports.
Uttar Pradesh has fully vaccinated 33 lakh people. That's just 1.8% of its 23 crore plus population. 3 weeks ago, UP was the first state to put out a global tender for 4 crore vaccine doses. But already, the state has extended its bid opening date by 10 days to the end of the month. The government has relaxed storage and transportation requirement from 2 to 8 degrees to ranges like -20 degrees, -70 degrees or even -80 degrees. Government sources say this has been done to facilitate bids from vaccine makers like Pfizer and Moderna. But it's not clear whether any bids have come in so far. The government has not said anything on record, but sources say they do expect some companies to bid now that tender requirements have been modified. UP's other big challenge, finding adequate vaccines to cover people in its vast rural areas and overcoming hesitancy. In the Barabanki district, less than 50 kilometers from capital Lucknow, just 1/3 of the targeted 1.2 lakh doses have been administered so far in May. And this visit by a health team to a village on Saturday resulted in chaos, with people reportedly jumping into a river to avoid getting vaccinated.
तो हम लोग 4 आदमी तो हम लोग गए थे लगवाने के लिए बैठे थे उसके बाद बोले कि और 4-6 आदमी और इकट्ठा कर लें तो लगाएं तब तक गांव में जब आए आदमी बुलाने के लिए तो डर के हमारे आदमी भागना शुरू कर दिया।
उसमें ज़्यादातर छोटे बच्चे थे। ये भी हो सकता है कि किसी ने कोई अन्य अफवाह उड़ा दी होगी जिस कारण से वो लोग उस नदी में चले गए थे। ये बात हम सबको माननी पड़ेगी कि इस समय कोविड से बचाव का इससे ज़्यादा सटीक तरीका, माध्यम या उपाय कोई भी नहीं है। तो मैं सभी से चाहूंगा कि किसी प्रकार के भ्रम से या भ्रांतियों से बचे।
In remote Sonbhadra in eastern UP, where only 1.2 lakh doses have been administered to about 90,000 people, police teams are now appealing to people to get vaccinated. With Adnan, Sarfaraz and Prabhat Kumar, this is Alok Pandey, NDTV.
Now, the lockdown in Tamil Nadu was extended and made stricter. New restrictions are in place, and even vegetable and grocery shops are now shut. Sam Daniel gets us the full story.
Intense lockdown across Tamil Nadu for a week, as the state is reporting over 35,000 cases every day for the last 4 days. This time, even vegetable and grocery shops shut down. The government has arranged mobile vegetable outlets like this one. During the weekend, prices had skyrocketed due to panic buying.
Yesterday I will buy 1 kg tomato 65 rupees. Today I buy only 50 rupees.
This is very good system.
Extension of the lockdown has meant no income for construction laborers like Money. He and his friends from Kadalur district survived on the 500 rupees they would earn every day. Now they are without work or earning for the third week. Even as COVID numbers are soaring, Tamil Nadu opened vaccination for the 18 plus category with a stock of 12 lakh doses. IT professional Titus is among the first to get inoculated in this category. Priority will be given to vendors, industrial workers, teachers and shopkeepers.
It's up to each and every individual person to control the virus. So it's our duty to stop this third wave or fourth wave or whatever it is.
Many are critical of the ruling DMK for opening the floodgates of shopping and outstation travel over the weekend. The state government provides a relief of 4,000 rupees to the poor in May and June, and it hopes the present strict enforcement would pave way for rapid decline in cases. In Chennai with Shah Vijay, Sam Daniel, for NDTV.
Now, the Delhi police teams landed at the offices of Twitter India on Monday evening after serving notices to the social media giant in a row over BJP leader Sambit Patra's tweet on an alleged Congress toolkit being marked as manipulated media. Remember, the Congress has denied that this is their toolkit. The police said they went to the Twitter India's offices in South Delhi and in Gurugram to hand the notice in person after finding the company's replies ambiguous. The special cell cops were seen at the Delhi office, which was shut as most employees are working from home in the COVID lockdown. An officer was seen asking an employee for the names of the top managers. The police, however, refused to reveal details of the complaint or the complainant. This action led to a lot of criticism from the opposition. Now, according to what Delhi police sources have told NDTV, they said the Delhi police team went to Twitter office to serve a notice to Twitter as part of a routine process. This was necessitated as we wanted to ascertain who is the right person to serve a notice, as replies by Twitter India MD have been very ambiguous. While government sources told NDTV on the outrage that this visit sparked, the government sources commented saying there has been a lot of hue and cry today when Delhi police went to serve a notice to Twitter. However, this is the third notice given by Delhi police to Twitter. Instead of cooperating with law enforcement, Twitter has tried to play victim by mischievously overplaying a routine procedure this time. And staying with news of social media giants, a set of central rules to regulate digital content featuring a code of ethics, a 3-tier grievance redressal framework come into effect in 2 days without any of the social media giants, Twitter, Facebook and Instagram complying to any of these rules is what government sources have said. So the question is, what happens after 2 days? Now, the rules for the news sites and OTT platforms were announced in February. They were given 3 months to comply. Sources said if the companies fail to follow the rules, their intermediary status can be ended and they may be subject to criminal action. The rules include appointment of an India-based compliance official. Now, a meeting to select the next chief of the CBI was attended yesterday by the Chief Justice of India, N.V. Ramana, and Leader of Opposition, Adhir Ranjan Chaudhary, at the Prime Minister Narendra Modi's house, with the powerful panel shortlisting 3 candidates, according to sources. Now, what NDTV has learned, the Chief Justice at the meeting, citing Prakash Singh's judgment, laid out a condition that officers with less than 6 months tenure in service should not be considered for the director's post. With the leader of opposition, Adhir Ranjan Chaudhary, also supporting this rule. This got the majority in this 3-member committee. This rule eliminated all the preferred choices of the government, which includes Rakesh Asthana, who's retiring on August 31st, and YC Modi, retiring on May 31st. Finally, the committee unanimously finalized Subodh Kumar Jaiswal, Maharashtra cadre, also Officer Kumar Rakesh Chandra, and Andhra Pradesh cadre officer VSK Komudi. Being senior out of the 3, former Maharashtra DGP and current CISF DG Subodh Kumar Jaiswal is likely to be appointed as the next CBI director. But the Chief Justice, with his insistence on that rule, surprised the government and ruled out their preferred candidates. All right, let's get you the latest on the farmers' protest. And yesterday, farmers observed are going to be observing, in fact, on the 26th, a Black Day. It marks 6 months of the farmer protest. Yesterday, farmer groups gherowed the office of the commissioner in Hisar with demands that the police complaints that have been made against protesting farmers be dropped. Here's a report.
Farmers celebrating after the demands were met by the Hisar administration. After a marathon meeting between Samyukt Kisan Morcha leaders and top police officials of Hisar.
Government has agreed to withdraw all the cases registered on 16th against the farmers. And apart from that, a farmer who died today, his son will be given job.
Earlier in the morning, thousands of farmers gathered in Hisar to protest against FIRs against 350 farmers for allegedly attacking government employees on May 16. Meanwhile, Haryana administration deployed thousands of personnel, including 3,000 RAF personnel, to stop farmers from surrounding the office of the commissioner. During the protest, Ramchandar, a farmer from the Ugrahan village in Hisar, who was part of the agitation, died at the protest site. Farmers have said they will continue to protest against the 3 farm laws.
जून 2024 तक काम प्लान बना कर चल रहे हैं हम कच्चा प्लान नहीं अब हाँ हम तो आगे 22, 23 और 24 3 साल का प्लान बनाकर अभी से चलेंगे.
The victory in Hisar has re-energized the movement of the farmers that was starting to lose steam. Now, the farmers claim that they will intensify their agitation further, but is victory in Hisar enough to bring back the central government on the talking table with the farmers remains a big question. With camera person Sachin Gupta and colleague Sanjay Jain, I'm Akshay Dongre for NDTV.
Cyclonic storm Yas is very likely to intensify into a very severe cyclonic storm as it makes landfall on the 26th of May. It would reach northwest Bay of Bengal near North Odisha and West Bengal coast by the 26th May early morning. Kolkata had a narrow escape, but in fact, let's take a look at the arrangements that have been made ahead of the cyclone.
Cyclonic storm by 24th May.
Somewhere between Sagar Islands in Bengal and Paradip in Odisha, most likely at Balasore. That's where Cyclone Yas is expected to make landfall around noon on Wednesday. Wind speeds at landfall 155 to 165, gusting at 185 kilometers per hour.
सबसे पहले लोगों को सुरक्षित स्थान में ले जाने के लिए जो साइक्लोन शेल्टर्स में सब अरेंजमेंट होना चाहिए वो सब अरेंजमेंट कंप्लीट है. अलावा उसके क्योंकि कोविड का समय है, हर साइक्लोन शेल्टर में कोविड अप्रोप्रिएट बिहेवियर और कोविड के हिसाब से जिस तरह की मेडिकल फैसिलिटीज, बेसिक मिनिमम फैसिलिटीज होना चाहिए उसका भी सारा इंतजाम कर लिया गया है. विद इन दिस स्टेट वी हैव मेड एडिक्वेट प्रोविजन फॉर बैकअप सिलेंडर्स and also buffer stock.
In Kolkata, Mamata Banerjee virtually met Home Minister Amit Shah along with her Odisha and Andhra counterparts, who she said were being given more money as disaster management advance than Bengal.
And Bengal they said 400 something crore. Then I told Amit Shah ji that why this discrimination? Mr. Home Minister said, ममता जी हम बाद में बात करेंगे, ये साइंटिफिक व्यू से होता है, साइंस से होता है. इसका बारे में मैंने यार कुछ नहीं बोला कि मेरे को पॉलिटिकल साइंस का बारे में थोड़ा ज्ञान है, लेकिन ये साइंस का बारे में तो नॉलेज कम है.
Around 10 lakh people are being evacuated from the East Midnapur district in Bengal as well as the low-lying Sundarbans areas. Kolkata, which bore the brunt of cyclone Amphan last year, may this time have a lucky escape.
Kolkata narrow escape definitely, but our coastal districts of Purba Midnapur and South Chowbish Pargana will be affected.
The bandobast is falling in place, with NDRF, the military and the Coast Guard on full alert, not just to handle Cyclone Yas, but also its aftermath. In Kolkata, with Anirudh Tripathi, Monideepa Banerjee, NDTV.
Time for us to slip into a short break. On the other side, Mehul Choksi has gone missing in Antigua. We'll get you all the details. Welcome back. Now, fugitive jeweler Mehul Choksi, who's wanted by the CBI and Enforcement Directorate in India, has gone missing in Antigua. His lawyer has told NDTV. In fact, he went missing. His lawyer, Vijay Agarwal, confirmed that he's missing in the island nation. According to reports, Antigua, the police there have launched a manhunt for him, and it was reported that he left his home to go out for dinner and has since gone missing. Let's go across to Neeta now for more. Neeta, Mehul Choksi's lawyer has confirmed to you that he indeed has gone missing and his family too is looking for him. Give us the details.
Yes, Gargi, you know, his vehicle was found near a famous Jolly Harbour area in Antigua. The police is searching for him. A manhunt has been launched for him. Sources are also telling us that he had gone there for dinner on Sunday night, and since then he has been missing. His lawyer, Mr. Pradeep, has confirmed to NDTV that his family is also is looking for him. They are also worried because he has been missing since Sunday night. But as of now, where is he? His whereabouts are not known. The police is also looking for him, and he is missing. And the vehicle was found. That's what even the agencies which were dealing with his extradition matter also tell us, that an abandoned vehicle was found near a well-known restaurant near Jolly Harbour area in Antigua.
All right, so that's a very curious turn in the entire case. Mehul Choksi has gone missing. This after he went out ostensibly for dinner, hasn't been seen since, and the police too are now looking for him. Time for us to slip into a short break. We'll get you all the news updates on the other side. Stay with us. Now, the big cause of concern in India's fight against the pandemic continues to remain our shortage of vaccines, down by about 14%. In fact, the vaccinations in the last 24 hours, the daily vaccinations are 57% less than the daily production, and daily doses produced are over 28 lakhs. That's what the centre told the Kerala High Court, whereas the daily jabs are just 12 to 13 lakhs. Now, remember, states and union territories are looking for more vaccine supplies. Karnataka, Tamil Nadu, UP, Delhi, even Mumbai have put up tenders for over 155 million doses. These are global tenders, but not one has been secured. Delhi and Punjab governments have said that Pfizer and Moderna have refused to supply to states. Here's a report on India's failure to import vaccines.
On the 1st of May, the centre said state governments should go ahead and import COVID vaccines separately. Since then, states and union territories like Karnataka, Tamil Nadu, Uttar Pradesh, Delhi and even Mumbai in Maharashtra have put up tenders for over 155 million doses. But this has largely been a non-starter. For one, states like Punjab and Delhi have been rejected by Moderna and Pfizer, who have reportedly told the governments they'll deal with the centre.
हमारी फाइजर से बात हुई, फाइजर वाले कहते हैं जी आपको नहीं देंगे, हम केंद्र सरकार से बात करेंगे. हमारी मॉडर्ना से बात हुई, मॉडर्ना वाले कहते हैं जी हम आपको नहीं देंगे, हम केंद्र सरकार से बात करेंगे।
चाहे फाइजर हो, मॉडर्ना हो, हम उन सबके साथ सेंट्रल लेवल से कोऑर्डिनेट करते हुए उनको दो तरीके से फैसिलिटेट कर रहे हैं। एक तो उनके रेगुलेटरी फैसिलिटेशन इन टर्म्स ऑफ अप्रूवल्स, दूसरा प्रोक्योरमेंट रिलेटेड फैसिलिटेशन। और बोथ फाइजर एंड मॉडर्ना most of the time their orders books is already full, so it is depending on their surplus how much they can provide to India. They will come back to Government of India and will ensure and facilitate.
Several other states including Assam and other governed by the BJP or BJP allies are reluctant to do so.
I don't think these global tenders all are, I don't know whether it has any value beyond publicity, because when Government of India is not getting vaccine, where from other company will give you in global tender? I don't think that I am basically observing the situation. Other states are floating.
आप ग्लोबल टेंडर के बारे में थोड़ा और जानकारी ले लीजिए कि यदि किसी ने प्रयास किया है तो क्या परिणाम आए।
यानी कि आपको लगता है इसका कोई फायदा है?
मैं ये नहीं कर रहा, मैं कह रहा हूँ आप पता कीजिए यदि किसी ने प्रयास किया तो उसके परिणाम क्या है।
Of the over 155 million doses sought, Mumbai has made some headway, with Sputnik suppliers putting in 3 bids for 10 million doses. However, states like Uttar Pradesh, which wants to import 40 million doses, has had to extend the deadline.
Uttar Pradesh, which floated the global tender first on the 4th of May, has now been forced to revise the timings for the opening of the technical bids of the tender by 10 days to the 31st of May. The state has also revised tender conditions like the storage and transportation of the vaccines in a bid, sources say, to attract companies like Pfizer and Moderna.
Another badly hit state, Karnataka's deadline ends today.
Today is the last day for the global tender. Let us see what is the response. Depending on the response, we just reached out to the entire world.
While the government has set a target of vaccinating the adult population by the end of 2021, the current rate of vaccination shows the target can be achieved only by the end of 2023. With Maya Sharma, Alok Pandey, Manish Kumar, Ratnadeep Chaudhary and camera person Manu Nair, this is Arvind Gunasekar for NDTV.
Now, some vaccine makers have refused to deal with state governments regarding the supply of vaccines. Kerala Chief Minister Pinarayi Vijayan has written a letter to Prime Minister Narendra Modi saying that the central government should procure the supply. The Chief Minister also said that vaccines procured should be distributed free of cost to states. In the letter, Vijayan said that universal vaccination drive is the only way to achieve herd immunity against coronavirus disease in the long run. He says the centre should float a global tender for the vaccines. News now from Madhya Pradesh, where a funeral procession for a religious preacher, Khalil Qureshi, broke all COVID curfew rules. This is in the Tikra town of Madhya Pradesh's Barwani district. There, take a look at the crowds that have gathered for that funeral procession. Now, an FIR has been filed and 22 people have been named.
अभी तक तो 22 लोगों के खिलाफ में हुआ है FIR. आगे हमारे द्वारा जो है उनको अनाउंस किया गया था और वीडियोग्राफी की गई है. वीडियोग्राफी के आधार पर उनकी अन्य लोगों की पहचान की जाकर उनके खिलाफ भी कार्रवाई की जाएगी.
Now, in other news, a large section of Kerala, including celebrities, politicians, social media users and general public, are angry or wary about some of the changes being brought about in the Union Territory's newly appointed administrator, Praful Patel, in Lakshadweep. Now, according to the changes he's brought about since taking over in December 2020, they allege they are destructive and target its largely Muslim population. Many of them allege seeking his recall now. The BJP has, however, said they were only meant to end corrupt practices of politicians. Well, let's go across to NDTV Sneha for more. And Sneha, tell us more about this controversy that has suddenly, broken out, and now many MPs have also written to the president asking for Praful K. Patel to be recalled.
Well, that's right. In fact, Gargi, if you look at the responses from Kerala, it's also cutting across political lines, whether it be the CPIM or the Congress. Of course, it was one of the first letters written to the President of India was from the CPIM parliamentarian, Mr. Karim, following which you also had Haibi Eden, the Congress parliamentarian write to the President and the Prime Minister. We've had the Chief Minister of Kerala respond and react to the situation in Lakshadweep. We've had several politicians, including former Finance Minister Thomas Isaac, or even celebrities and actors like Prithvi Raj, who have reacted to what is happening in Lakshadweep. Now, among the various allegations which are being raised, which is all against the new administrator. When I say new administrator, he took over in December 2020. He was appointed, and Mr. Praful Patel. Now, couple of just to run through these allegations that have emerged in these letters. One is in terms of the protocols or the SOPs that were changed unilaterally in courts with respect to the COVID pandemic, and the allegations are that has led to the increase in numbers for COVID cases. These are letters by the parliamentarians. Then there's also allegations of how there have been attempts to change the food pattern, restrictions on in the name of animal prevention. It's in terms of the regulations that have been brought to ban slaughter, transportation, selling or buying of beef products in one of the orders, or the proposal of not allowing people with more than 2 children to participate, to stand for panchayat elections or to contest panchayat elections. That's a proposal which is in place according to the letter. So a lot of, and of course, the fact that they are looking at making the Mangalore the point of water transport and not what it was earlier, Bayport Port in Kozhikode.
Right.
So combination of all of these things have emerged. A lot of people in Lakshadweep live in Kerala. So they've taken to the Twitter raising concerns over this. Parliamentarians in Kerala raising this, even as other elected representatives. BJP, of course, saying that this is just the elected representatives are playing to the tunes of instigation of false accusations, and these are efforts to contain or check corruption. But that's, of course, the BJP response. And but a lot of angst and a lot of concerns, even seen on social media by ordinary citizens of Lakshadweep.
All right, Sneha, thanks so much for joining us with those details. So a major outrage there in Kerala over these changes that are brought about in Lakshadweep, with letters even being written to the president. Hello and welcome. You're watching Good Morning India. I'm Gargi Rawat. Our top story: Delhi police teams landed at the offices of Twitter India on Monday evening after serving notice to the social media giant in a row over BJP leader Sambit Patra's tweet on an alleged Congress toolkit being marked as manipulated media. The Congress had claimed that this toolkit was not theirs after it was shared by Sambit Patra. Later, Twitter had marked it as manipulated media. Now, the police said they went to Twitter India's office in South Delhi and at Gurgaon to hand the notice in person after finding the company's replies ambiguous. Special cell cops were seen at the Delhi office, which was shut as most employees are working from home in the COVID lockdown. An officer was seen asking an employee for the names of the top managers. So far, the police has refused to reveal details of the complaint, or the complainant. The Delhi police has said that they went to serve a notice. This was necessitated as we wanted to ascertain who is the right person to serve a notice, as replies from Twitter India ND have been ambiguous. Government sources have told NDTV this is their version after the opposition had criticized this move. Government sources said there has been a lot of hue and cry today when Delhi police went to serve a notice to Twitter. However, this is the third notice given by the Delhi police to Twitter. Instead of cooperating with law enforcement, Twitter has tried to play victim by mischievously overplaying a routine procedure this time. Well, let's go across to Neeta for more. And Neeta, government sources trying to downplay this entire visit, calling it a routine procedure. However, of course, it did create a lot of controversy and outrage with opposition members, questioning this sort of visit by Delhi police cops. So far, we don't know who the complainant is in this matter, isn't it?
Absolutely. We don't know who the complainant is and what sort of the complaint that he has registered, that they need to go and visit Twitter offices and, find out. The Delhi police might be saying, the official version which came from Delhi police was, as you were mentioning, that they just went to serve a notice to Twitter offices because they were not getting a clear reply. Government sources are also telling NDTV that this was the third notice which was served to Twitter, and they have not been complying to the notices, and that is why the police team went to serve the notice physically. But it is very strange because it's not the first time that Twitter authorities have got into a tiff with Indian government. Earlier also, when Indian farmers' agitation was going on, Indian government had wanted Twitter to remove certain, tweets. So in that backdrop, this is very interesting as to how, this time even the complainant is missing. We don't know who the complainant is and what sort of a complaint has he registered, under what sections have they gone to, search for whatever that they need to search for. However, both the government and the Delhi police have been trying to downplay it, Gargi. But it was very interesting to see the Delhi police, fully prepared, landed at Ladosarai and also in Gurgaon offices of Twitter, while, it was well known that most of the companies, both in Gurgaon and in Delhi, because the lockdown is going on, have been working from home, but they still landed and, tried to generate some kind of a media hype, also trying to find out where the Twitter offices were, but they returned empty-handed. But they are saying that they have been able to, serve that notice by pasting it on the wall. Gargi?
Right, Neeta. Now, so what happens next? We haven't managed to get any, real response from Twitter. Initially, we didn't even know exactly what complaint they had gone for, because we do know that when the BJP, when Sambit Patra shared what he alleged was this Congress toolkit, the Congress had claimed that this was a forgery, and they said they would be filing a complaint over this. So initially, we even thought at the time that perhaps it was based on the Congress's complaint, but right now we still don't know. We know that that tweet of Sambit Patra's was labelled as manipulated media and something that the government wasn't happy over.
Absolutely. As far as this tweet is concerned, even my team, Ministry of Electronics, Information and Technology, have been mentioning, that Twitter cannot, just say that A tweet is manipulative or B tweet is manipulative, because these are the investigations which are supposed to be done by Indian investigating agencies. So earlier also they had, put forward their point of view that you cannot label a tweet manipulative. But in this case, now they have gone ahead and, served notices on Twitter. This is the third notice. Obviously, the law is taking its own course, and if they again do not comply, then obviously it will go a step further. Maybe, they would be trying to get some kind of a warrant or some kind of a, strict action would be taken against them, because even as you were mentioning, the government sources have also been telling NDTV that it is, a hue and cry which has been raised by Twitter authorities. Rather than just complying with Indian laws, they are trying to, make it play as a victim. That's what the sources are telling. So obviously the tiff between the Twitter authorities and Indian investigating agencies will escalate in coming days. Gargi?
All right, Neeta, thanks so much for joining us with all those details and the very latest on that story. And staying with news of social media giants, a set of central rules to regulate digital content featuring a code of ethics, a 3-tier grievance redressal framework come into effect in 2 days' time without any of the social media giants, that's Twitter, Facebook and Instagram, complying to any of these rules. That's what government sources have said. The rules for news sites and OTT platforms were announced in February, and they were given 3 months to comply. Sources said that if the companies fail to follow the rules, their intermediary status can be ended and they may be subject to criminal action. The rules include appointing an India-based compliance official. Now, the other big story we're tracking, fugitive jeweler Mehul Choksi, who's wanted by the CBI and Enforcement Directorate, has gone missing in Antigua and Barbuda. Mr. Choksi's lawyer, Vijay Agarwal, confirmed to NDTV that he is missing and that his family and the island nation's police are in fact looking for him. Well, let's go back to Neeta for more on this story. And Neeta, you spoke to the lawyer, and what's curious is that Mr. Choksi had gone for dinner and he's now gone missing.
Absolutely. He had gone for dinner. A manhunt was launched for him after, abandoned vehicle. His abandoned vehicle was found near a harbour. some sources are also telling us, this intelligence sources are also telling us, quoting whatever has been printed in Antigua press, that maybe Mr. Choksi might have shifted his base from Antigua to Cuba also. This would be very interesting, Gargi, because Cuba does not have any extradition treaty with India. India has been pursuing extradition of Mehul Choksi for last 2 years now, and back and forth, Ministry of External Affairs, CBI have been sending all kinds of notices. Even Antigua government had assured that he would be extradited back. In such a backdrop that he goes missing from a restaurant and his abandoned vehicle is found there, which is going to be very interesting. His family is also worried. His lawyer, Mr. Pradeep, confirmed to NDTV that he is missing, and that they have informed the local police authorities, and they are also searching for him as of now. Gargi?
All right, so that's a very curious twist to the entire story. Mehul Choksi has gone missing and the police in Antigua are searching for him. The CBI too was taken by surprise by this news, and they're now getting in touch with the authorities to find out more. Thank you so much, Neeta, for joining us with that. In other news now, a meeting to select the next chief of the CBI was attended by the Chief Justice of India, N.V. Ramana, and leader of the opposition, Adhir Ranjan Chaudhary, at Prime Minister Narendra Modi's house on Monday, with a powerful panel shortlisting 3 candidates. According to sources, NDTV's learned that the Chief Justice, N.V. Ramana, in the meeting cited the Prakash Singh judgment, laid out a condition that officers with less than 6 months tenure in service should not be considered for the director of the CBI post, with the leader of opposition, Adhir Ranjan Chaudhary, also supporting this rule. This got the majority in the 3-member committee, and this rule, in fact, eliminated the preferred choices of the government. Well, let's go across to NDTV's Arvind for more on this story. So, Arvind, the Chief Justice's insistence that this rule be followed, it is a precedent and it is a rule that is followed. This eliminated Rakesh Asthana and YC Modi, who were in the government's top choices?
Gargi, the high-powered committee headed by Prime Minister Narendra Modi and also 2 other members, leader of opposition Adhir Ranjan Chaudhary, and also the Chief Justice of India, N.V. Ramana, met yesterday for the selection of the next CBI director. So the earlier CBI director, R.K. Shukla, retired on February 3rd, post which the additional director, Praveen Sinha, has been given the additional charge. So in yesterday's meeting, the panel was supposed to consider somewhere around 130 names. In fact, the topmost 4 batches 1984 to 1987 were taken into consideration. Almost 109 serving IPS officers were taken for consideration. At around 1 p.m., what we are being told is that at around 1 p.m., the committee members were provided with 10 shortlisted names out of this 109. And again, before the meeting, it was again further narrowed down to 6 names. So that at the meeting, the committee members actually considered only 6 names for the CBI top post. What we are being told by our sources is that during the meeting, the Chief Justice of India, N.V. Ramana, who is also a member of the committee, he cited the Supreme Court judgment in the Prakash Singh case. In that particular case, Supreme Court has clearly said that for all the police chief posts, only the officers with more than 6 months service in tenure in service should be considered. So when CJ insisted that this particular law should be followed for the selection of CBI director, that's when all the 1984 batch officers, in fact, if you could see, the 1984 is the senior most batch when it comes to the selection of CBI director. Almost senior officers like Rakesh Asthana, who was the former special director in CBI, currently who is the Director General of BSF, and also YC Modi, who is the Director General of NIA, who heads the NIA. Both these officers were ruled out only because of this particular rule. When CJ insisted that this particular 6 months tenure should be strictly followed for the selection of CBI director also, that's when both these officers were ruled out from the contention. So actually what we are being told is that government preferred these 2 officers. Government wanted one among these 2 officers to be appointed as the CBI director. But when CJ insisted that this particular Prakash Singh judgment should also be implemented for the CBI director, and also Adhir Ranjan Chaudhary also supporting the CJ's contention, CJ's argument there, that's when they got the majority, and government's preferred choices were eliminated when this 6 months rule was invoked in this particular selection. This is for the first time ever for the selection of CBI director, such a 6 months rule is being implemented. Even during the earlier times also, this 6 months rules was never implemented. This is the first time such a rule was invoked and being implemented. Coming to the next, what we are being told is that at the end of the meeting, all the three members unanimously they finalized 3 names that included Subodh Kumar Jaiswal, who is the former Maharashtra DGP and who is the current DGP CISF, and also 2 other officers, Kumar Rajesh Chandra, and also the 3rd officer, VSK Kaumudi. So what we are being told is that Subodh Kumar Jaiswal, who is the former Maharashtra DGP, is the front runner of this post, and today the DOPT will be issuing the formal orders appointing Subodh Kumar Jaiswal as the next CBI director. Gargi?
All right, Arvind, so fascinating details of that meeting to select the next CBI chief. Thanks so much for joining us with that. Well, let's get you the latest COVID numbers now. And cases reported on Monday were 2,22,315, down nearly 7.7%. Deaths, however, were 4,454. They were up by 16%. Tests on Monday in 24-hour period were over 19.28 lakh. They were down 9.2%. The positivity rate was up by 1%, 11.53%, which is not good news. Vaccinations, however, were dismal. They remain a big worry. Under 10 lakh vaccinations taking place in a day, just 9.42 lakh vaccinations taking place. That's down by 14%. And do remember, experts have said the vaccinations should be between 60 to 80 lakh per day if we're going to manage to vaccinate a sizable portion of our population. Now, in the last 2 weeks, deaths have risen by 13%. They're rising very rapidly in 20 states and union territories. In 9 of these, 20 states, including Tamil Nadu, Kerala and Assam, deaths have risen by over 100%. In 11 other states, the increase in deaths is between 25 to 100%. However, in the worst hit, which is Maharashtra, it's 15%, while in Delhi and UP, the number of deaths is contracting now. Now, if we talk about Bengal, in Bengal, 9 days into the statewide lockdown, COVID infections dipped below 18,000 in the last 24 hours for the first time in 19 days. The North 24 Parganas district remains a hotspot, accounting for almost 1/3 of the deaths. In all, 153 people lost their lives in the last 24 hours in Bengal. The toll in North 24 Parganas was 47. And statewide positivity continues to climb up to 10.72%. A fresh worry is cases of a black fungus infection. 12 cases are confirmed in the state. 2 died in a private hospital. 6 of the 12 patients are COVID or post-COVID patients. Now, with the country facing a dire shortage of vaccines, as we said, under 10 lakh vaccinations taking place in a single day, some vaccine makers have also refused to deal with state governments regarding the supply of the COVID vaccines. Remember, the centre has left it to the state governments, who are now putting out global tenders to vaccine makers, but they've refused to deal with states. They want to only deal with the centre. Now, Kerala Chief Minister Pinarayi Vijayan has written a letter to Prime Minister Narendra Modi saying that the central government should procure the supply. Well, let's go across to Sneha for more on this story. Sneha, give us more details of this letter and the Chief Minister of Kerala really, voicing concerns among many chief ministers and how it should be the centre that takes charge of ensuring the vaccine supply.
Well, that's right, Gargi. In fact, the Chief Minister during his daily press briefing said that he has written to the Prime Minister and that instead of different states floating different global tenders, it would be important that the central government floats a common global tender taking into stock the requirement of the different states for the vaccine doses. Now, why is this coming up? According to the Chief Minister, if different global tenders are floated and there are multiple buyers in forms of different states, it's only going to be causing for fluctuation in prices, spurt in prices, and that's going to be a huge challenge. On the other hand, according to the Chief Minister, if the Prime Minister, the central government would go ahead and take the stock from the states in terms of how much of doses do they require, what would be the requirement, and they float one global tender, keeping in mind the requirements of different states, that would keep a check on the prices for these vaccine doses. So that's the rationale behind what the Chief Minister has written to the Prime Minister. But apart from that, also, Gargi, the global tender in Kerala has also been floated. The last day for that to be applying for the submissions for applications is going to be 2nd June, and it's from 5th June onwards that it will be opened up for your technical submissions. Now, today there is in fact a very important meeting around 11 o'clock. It's called a pre-tender meeting with the vendors, where there will be talks with the vendors and trying to explain to them if they have any concerns or doubts about the process, or what would be, or any kind of doubts that they would have. So that meeting is happening today. And the Kerala government has also gone ahead and floated a global tender for 3 crore vaccine doses.
All right. Thanks so much, Sneha, for joining us with all those details. So a big cause of concern is India's low vaccination rates. They're down by 14% in the last 24 hours. In fact, the daily vaccinations are 57% less than the daily production of vaccines. So that's a curious gap. Daily doses produced are over 28 lakhs, according to what the centre has said. But the daily jabs being given are 12 to 13 lakhs. And as we were mentioning, states and union territories like Karnataka, Tamil Nadu, UP, Delhi, even Mumbai put up tenders for over 155 million doses of vaccines, but not one has been secured. Delhi and Punjab governments, in fact, said that Pfizer and Moderna have refused to supply to the states, saying they will only deal with the centre. Here's a report on India's failure to import vaccines.
On the 1st of May, the centre said state governments should go ahead and import COVID vaccines separately. Since then, states and union territories like Karnataka, Tamil Nadu, Uttar Pradesh, Delhi and even Mumbai in Maharashtra have put up tenders for over 155 million doses. But this has largely been a non-starter. For one, states like Punjab and Delhi have been rejected by Moderna and Pfizer, who have reportedly told the governments they'll deal with the centre.
हमारी फाइजर से बात हुई, फाइजर वाले कहते हैं जी आपको नहीं देंगे, हम केंद्र सरकार से बात करेंगे. हमारी मॉडर्ना से बात हुई, मॉडर्ना वाले कहते हैं जी हम आपको नहीं देंगे, हम केंद्र सरकार से बात करेंगे.
चाहे फाइजर हो, मॉडर्ना हो, हम उन सबके साथ सेंट्रल लेवल से कोऑर्डिनेट करते हुए उनको 2 तरीके से फैसिलिटेट कर रहे हैं. एक तो उनके रेगुलेटरी फैसिलिटेशन इन टर्म्स ऑफ अप्रूवल्स, दूसरा प्रोक्योरमेंट रिलेटेड फैसिलिटेशन. और बोथ फाइजर एंड मॉडर्ना, most of the time their orders books is already full, so it is depending on their surplus how much they can provide to India. They will come back to Government of India and will ensure and facilitate.
Several other states, including Assam and other governed by the BJP or BJP allies, are reluctant to do so.
I don't think these global tenders all are, I don't know whether it has any value beyond publicity, because when Government of India is not getting vaccine, where from other company will give you in global tender? I don't think that I am basically observing the situation. Other states are floating.
आप global tender के बारे में थोड़ा और जानकारी ले लीजिए कि यदि किसी ने प्रयास किया है तो क्या परिणाम आए.
यानी कि आपको लगता है इसका कोई फायदा है?
मैं ये नहीं कर रहा, मैं कह रहा हूँ आप पता कीजिए यदि किसी ने प्रयास किया तो उसके परिणाम क्या हैं.
Of the over 155 million doses sought, Mumbai has made some headway, with Sputnik suppliers putting in 3 bids for 10 million doses. However, states like Uttar Pradesh, which wants to import 40 million doses, has had to extend the deadline.
Uttar Pradesh, which floated the global tender first on the 4th of May, has now been forced to revise the timings for the opening of the technical bids of the tender by 10 days to the 31st of May. The state has also revised tender conditions like the storage and transportation of the vaccines in a bid, sources say, to attract companies like Pfizer and Moderna.
Another badly hit state, Karnataka's deadline ends today.
Today is the last day for the global tender. Let us see what is the response. Depending on the response, we just reached out to the entire world.
While the government has set a target of vaccinating the adult population by the end of 2021, the current rate of vaccination shows the target can be achieved only by the end of 2023. With Maya Sharma, Alok Pandey, Manish Kumar, Ratnadeep Chaudhary and camera person Manu Nair, this is Arvind Gunasekar for NDTV.
Well, let's now get you the latest market update and take a look at markets opening. Markets have opened in the green. The Sensex gained over 150 points on opening. Let's just take a look at where the numbers are now. And there you can see the Nifty is up by 76.30, up by 0.5%. And these are the top gainers in the Nifty. JSW Steel gaining 2.17%, Hindalco gaining 2%, and Nifty top 6 gainers, Titan company gaining 1.7% this morning on opening. Tata Steel also in the green, gaining 1.66% on opening. GAIL India is also up by 1.65%. Let's bring up the auto movers now, and Tata Motors is up by 9.8%, nearly 1% there. But Motherson Sumi in the red, as you can see. Ashok Leyland is up by 1.12%, and Mahindra & Mahindra up by 1.28%. Apollo Tyres also up by 0.39%. So these are the top gainers in the auto stocks. And let's take a look at the BankX, and there you can see Yes Bank in the red, down 1%. SBI is in the green, up 3.2%. Federal Bank is flat there, and IDBI Bank is up by 0.26% this morning. ICICI Bank is up as well, and the top IT movers now, and Trigon Technologies is up by 2.23%. Wipro is up by 1%, and First Source Solutions, however, in the red, down by 0.14%. Take Solutions is down by 8%, and there you can see the Nifty up by 85.30, and the Sensex also in the green. It opened 150 points up. It's now up by 250 points. And Asian Paints, one of the big gainers, 2.37% this morning. It's up by Nestle, is up by 1.85%. So sectors there in the green. GAIL India is also 1.81% up, while Tata Steel is up by 1.73%, trading at 1,110. With that, time for us to slip into a short break. More news on the other side. Welcome back. Let's focus now on coronavirus in the country. And according to the data, that was released yesterday. Remember, we're expecting the fresh data from the Health Ministry any moment now. But yesterday, we gained 2.22 lakh cases. The cases were down by nearly 7.7%. The deaths recorded were 4,454. That's up by 16%. And a big worry with the deaths being so high. Tests over the 24-hour period on Monday were over 19.28, which was down 9.2%. The positivity rate worryingly has increased by 1% at 11.53%. But vaccinations is the big worry. Vaccinations under 10 lakh in a day, 9.42 lakh, down 14%. And that's a huge worry right now with the lack of vaccine doses. India has also crossed the 3 lakh death marks. And what's really disturbing is that almost 1 in the 3 deaths took place in May alone. That's a huge number of deaths taking place in May alone. In the last 2 weeks, in fact, deaths have risen at 13%. They're rising very rapidly in 20 states and union territories. In 9 of these 20 states, including Tamil Nadu, Kerala, Assam, deaths have risen by over 100%. In 11 other states, the increase in deaths is between 25 to 100%. However, in worst hit Maharashtra, it's 15%, while in Delhi and UP, the number of deaths is contracting now. Now, in order to increase the vaccine penetration, the government is allowing walk-in registration for the age group of 18 to 44. The government has said that people in this age group who are without access to internet or smartphones can now walk in for help to register on the CoWIN digital platform and get appointments and same-day vaccinations. However, they've left it to the states and union territory governments to decide on how this will actually take place on the ground, and that it can be based on local context. Well, to talk more about the COVID situation in the country, we're now joined by Dr. Ashwin Agarwal, Executive Director and Cataract and Cornea Refractive Surgeon at Dr. Agarwal's Group of Eye Hospital. Thank you so much for joining us, Dr. Agarwal. So currently in the country, the big worry is the lack of vaccines. Also, if we take a look at the number of deaths taking place, and given that such a huge proportion of deaths took place in May, what is disturbing is that we know that we went through a shortage and a struggle for a lot of hospital beds, for oxygen, and at this point, we don't know how many of those deaths were actually caused due to not being able to access resources on time.
Absolutely. I think the vaccination drive, as well as the care that is being given right now, is at its peak. And I think double or triple fold is what is required from the country's perspective to control these numbers. And I think what you've said is coined it in a very, very nice way. We need to go on a war footing to kind of, and everybody kind of needs to get into the act to solve this problem mystery.
Right now, most of the states are facing a vaccine shortage. Also, more and more cases of the black fungus being reported. Then there are also cases of white fungus that affects the eyes, and even now a case in UP of something called the yellow fungus. So, Doctor, if you could tell us a bit about this. And I know that we've been reporting for some time about how it's this combination of steroids and immunity being very, very low, and diabetes that is leading to this.
Yeah, I think, just for the audience perspective and keeping to time, I think it's important to understand what the differences is between these three viruses, these three fungus. You have the white fungus, which is a very common fungus, also called as Candida. So that's a very common fungus. It's a little low lethal. When I say lethal, it could cause infection, but the fatality rate is low. So that's something that we need to understand. But versus that, if you look at black fungus and the yellow fungus, they have a very high fatality rate. They could be compared between 50 to 60% of fatality rate. So the one thing that I want to tell people, if they're watching this, is if you're having any of these symptoms, and I'll come to the symptoms very soon, but if you're having any symptoms of black or yellow fungus, don't hesitate to go and visit a doctor, an ENT or an ophthalmologist, to kind of diagnose your situation or your condition immediately, because the diagnosis is the key to the success in survival rate over here. Coming to some of the symptoms of black fungus and yellow fungus, because these are the two main ones that we really need to be worried about. Black fungus, you look at proptosis. When you say proptosis, protrusion of the eye. When you look at discoloration around the skin of the paranasal sinuses, the nose, and the one-sided edema, one-sided pain. Any of these symptoms, if you find nasal blockages, nasal secretion, any of these symptoms, don't hesitate to go and visit an ophthalmologist or an ENT or even your general ER. These yellow fungus versus, when you compare these two, the yellow fungus will have more of an internal disease process. So it's more of loss of appetite, very, very lethargic, very, very weak body types, and also sunken eyes. Right. These are some of the symptoms that you want to be worried about.
And it's very important to catch it early, because treating it when it's too far gone is very, very difficult. We're also joined by Dr. Hemant Gupta, a gastroenterologist from Varanasi. Thank you so much for joining us, Doctor. And, we're talking about the trends and how cases are coming down. However, deaths remain a big worry. Deaths being reported over 4,000. Also, the penetration of COVID in rural areas is another big worry, because there's not enough awareness. If you could tell us a bit more about the situation in UP right now, and, the reports coming from villages of people dying. Sometimes, they're told they have typhoid, even talk of mysterious illnesses. But we do know that it's COVID that has reached, deep into the hinterland.
Thank you so much. Actually, COVID has penetrated the rural areas, and maybe because of the last elections which were held here, the Pradhan's elections which were held here in the rural areas. And the facilities of getting tested are limited. So these patients usually go for a typhoid test, and they come as positive, and they think that it is a typhoid. So I think if the symptoms are of COVID and you have a running nose, sore throat, even if your report is typhoid positive, one should go for a COVID RT-PCR. But actually, the death rates after the state and the administration has worked really hard in UP, they are actually coming down. So right now we can see a downtrend in the UP villages as well.
All right, so that is some positive news. Also, Doctor, earlier I was reading out some, statistics about how the number of deaths being very high and how we've crossed the 3 lakh mark, and 1 in 3 deaths took place in May alone. Now, we do know that in May was, the peak of this second wave, and we do know there was a lot of shortages of a lot of resources, even in Delhi, a lack of oxygen, people, trying to desperately get an oxygen bed in hospital, which wasn't happening. So what we also need to analyze is how many of these deaths were, due to COVID, or how many of them took place because of a lack of access to resources, isn't it?
Well, the deaths were due to COVID, we would say, but there were lack of resources because the wave was, the patients which were coming to the hospitals was really high. And the facilities of oxygen and other drugs were not there. So the deaths were, you can say the deaths were due to lack of oxygen, but I would say the peak was very high and it was fatal. So I would still say the deaths were due to the COVID.
Right, and that peak was something that I think no country could have dealt with any given resources, though of course we had a huge shortage in many places as well. If we talk about treatments for COVID, that is also something that is really confusing the public because of all the changing rules or therapies. Plasma therapy we know has been absolutely dumped. Remdesivir is no longer advised by the WHO, and also now in India we have a new therapy available, monoclonal antibodies, which is something that was used to treat Trump. What can you tell us about this?
Well, actually, any treatment or any form of therapy requires lots of research in modern medicine. And sadly, we should say that we didn't get enough time to do research because it was a very new disease. So whatever we had in our hand, we tried that. And in that case, so many drugs came to us that the common man was confused, really confused. So, but I still think that if there are mild cases of COVID, just isolation, home quarantine, and probably the crocin, paracetamols, and other things. Very simple drugs are effective in treating 90-95% of cases.
Right. I just want to get in Dr. Agarwal here briefly. And one of the reasons that we're seeing a spurt in mucormycosis, of course, a lot of questions being raised, but is also because of the overuse of steroids. And that is something all doctors are now warning against.
Absolutely, Gargi. And I think it's important to understand that, there is this fear about COVID. That is one. But there's also a fear that we are religiously using steroids versus judiciously using them, and that's the difference that we probably need to understand at this level. And the audience probably just need to understand that the steroid is only used when the inflammation of the body is very high. You cannot use steroids, or you shouldn't use steroids when the inflammation is just about starting off, because that's the period of time where your body is kind of reacting and it could control the whole situation. But if you use steroids too prematurely, you're going to start depressing your immune system, and that really causes these fungal spores to kind of explode itself and expand. So we don't want to allow that. The second thing I would tell people is to actually wear a mask even after being diagnosed negative after COVID disease. Even after you've been diagnosed negative, wear a mask, clean your masks well, and ensure that if you are under oxygen, that is another part where, the yellow fungus can actually take over.
Right.
So try to be a little bit, because it happens in more humid conditions. It happens because of the conditions where you have diabetic, uncontrolled diabetes. These are very, very high risk. Please make sure that your hygiene factor is up at least 10 notches from what you were before.
All right. Well, thank you so much, doctors, for sparing the time and joining us on the channel this morning.
Thank you, Gargi.
Thank you.
Now, the Delhi government, in its efforts to prepare itself for a possible third wave of COVID, has arranged for oxygen cylinders in Delhi's Mayapuri Oxygen Depot area. This will house at least 6,000 oxygen cylinders, which have been imported from China. About a month ago, there was a massive outcry and several precious lives lost due to the oxygen emergency. But these efforts are being put in place by the government to ensure that there is enough supply. Shonakshi reports.
I come to you from an oxygen plant in Delhi's Mayapuri area. Now, in order to brace themselves for the third wave of the deadly coronavirus, the Delhi government has imported at least 6,000 oxygen cylinders, and 2,000 of which are here at this particular oxygen plant. As you can see, this oxygen cylinder here, a capacity of about 40 to 41 liters, also contributed by organizations like HCL and Give India. The Delhi government has to ensure that it is well prepared for an oxygen emergency if a situation of such arises in the coming months and the weeks. These oxygen cylinders are going to save lives. And joining me right now is Mr. Abhishek from this oxygen plant, the co-owner of this oxygen plant, to tell us a little bit more about this. Tell us a little bit about so many oxygen cylinders being placed by the Delhi government here in order to be prepared for the third wave of the deadly virus.
These cylinders are being imported by the government of India, and these are being stored in our premises just to take care of any emergency situation in case if it arises. So government is all geared up and prepared for an unfortunate event if in case it happens.
Tell us a little bit about these oxygen cylinders, the capacity, or isme kya one can know about these. How many of them are here?
Ma'am, we have approximately 2,000 cylinders right now in our premises, and these are approximately of 40 liters water capacity. And these are brand new cylinders. All of them are filled with the oxygen, and these can be used right away.
And what about the oxygen plant here? I can see there's a storage, a huge.
Yeah, we have.
What is the capacity of that?
We have a capacity of 21 metric tons.
Right.
In fact, we have converted one of our nitrogen tanks for the emergency situation into medical oxygen with the approval from the departments and all. So at present, the storage capacity in my plant is more than 30 metric tons. The stock, like our tanks are completely full, and we are getting oxygen on daily basis, and whatever the requirement is there, we are able to meet that at the most. Jitna bhi.
So situation thoda improve hua hai?
Situation is well in control now, and we are also much relaxed.
With camera person Sushil Rathi in Delhi, Shanakshi Chakravarti for NDTV.
Now in Bengaluru, which has been badly hit by the second wave, special care centres have come up exclusively for children. These centres are for children with families and also for children who lost their parents or those whose caregivers are unwell.
This young girl was alone in Bengaluru and struggling with COVID, with nobody to help her.
My uncle and auntie. I don't have a parent. I lost my mother, and my father is not touch with me. When I got a COVID, my uncle also got a serious COVID. He did not get bed in Karnataka. They went to Tamil Nadu and they left me alone here. No one was there to look after me. When I came, I was having the breathless. I was having to breathe. I was getting difficult to breathe also, and no one was there to give me a food also.
Help arrived late one night in the form of the Dream India network, who picked her up and brought her to this free centre, which looks after COVID-positive children. She was cared for here and has now tested negative.
Actually, the second wave of the pandemic, suddenly there had been a lot of news coming on the social media with regard to children losing their parents, children not able to be taken care, and we decided to have two types of centers. One is CCC, children infected, and second one, children those who are affected.
But recently, when this pandemic came, we thought of making use of this retreat center for the purpose of the people who are suffering.
There are 5 such centres in the city, set up and operated by Dream India Network, with the support of the state government, hospitals and other NGOs. They comply with child protection and COVID care centre guidelines. The children who are still COVID positive receive medical attention at the centre itself.
About 22 children who turned negative, and there are still about 8 children who are positive. So the management is pretty simple. We supplement them with vitamin C and zinc. That's helping them boost their immunity. And if there's any symptoms, we try and manage the symptoms as and how it is. The children are doing pretty good. The saturations are pretty normal. The vitals are pretty...
A helping hand for vulnerable children in Bengaluru city. With DM Kumar, Maya Sharma in Bengaluru for NDTV.
In other news now, a large section of people in Kerala, including celebrities, politicians, social media users, are angry over changes that have been brought about in Union Territory of Lakshadweep. They're agitated by some of the changes that were brought about by the newly appointed administrator, Praful K. Patel. The changes he's brought since taking over in December 2020 are destructive, they claim, and target its largely Muslim population. They've also led to an increase in COVID cases on the island. In fact, MPs from the left have also written to the president asking for his recall. Let's go across now to Sneha for more on this story. And Sneha, take us through this controversy that broke out yesterday with a lot of people on social media hitting out over these changes in Lakshadweep.
Well, that's right. In fact, Gargi, a lot of people from Kerala, whether it be politicians cutting across the party lines in the sense of either it be the left or the Congress or even other allied parties of their respective fronts, whether it be celebrities, actors like Prithviraj and even more people from Kerala, and even ordinary citizens have taken to the social media criticizing what is being seen as very unilateral decisions being taken by the administrator. There are parliamentarians. First, it was, of course, the CPIM parliamentarian, Mr. Karim. Then we had Congress parliamentarian, Haibi Eden, who've written to the president, written to the prime minister, seeking for the recall of the administrator. And making several allegations. Now, even the Chief Minister of Kerala has gone ahead and raised concerns about how cultural, traditional ties between Kerala and Lakshadweep. Kerala is a place where a lot of people from Lakshadweep come, study, work, live. These ties are being maliciously affected and the aim doesn't seem correct, is what the Chief Minister has said. In fact, he spoke about how, you know, there's this whole attempt of making transport through the water, the shift to Mangalore instead of what it was as Bepur, the port in Kozhikode. So that being one of the allegations. Then you've had Mr. Karim raise allegations about what concerns of people of Lakshadweep have been in terms of what it was. 0 cases during the first COVID wave in the country. In Lakshadweep, there were 0 cases, but now it's over 6K. People, according to the parliamentarian, are saying this is in terms of some arbitrary changes to the SOP by the administrator. You've had Haibi Eden, who's written. In fact, other parliamentarians also have mentioned about how there's attempts to change the pattern of eating, whether it be in terms of transport or slaughter, ban on slaughter, transport of beef or bovine. So that being one of the concerns. Mr. Haibi Eden has written about how there's been attempts to remove non-veg from the Anganwadi meals, but these are allegations, right. The BJP alleging that these are parliamentarians like Haibi Eden or Mr. Karim have taken to social media and otherwise instigated by certain motivated allegations, and BJP has claimed that all of this is part of attempts to curb or counter corruption, but people, locals as well as those living in Kerala, have been hugely concerned about this.
All right. Thank you, Sneha, for taking us through this entire controversy. Well, breaking news coming in. The latest COVID numbers have come out and India's cases have gone under 2 lakh. In fact, India reported 1,96,427 cases in the last 24 hours. So, India reporting under 2 lakh COVID cases in 24 hours. Deaths have gone down as well, under 4,000, with 3,511 deaths being reported in the last 24 hours. The positivity rate has gone under 10%. It's at 9.54%. And vaccinations that took place in the last 24 hours are 24,30,236. So that's some good news. It's gone up from the previous day. However, it's still very, very low. Remember, experts say we should be vaccinating at least 80 lakh a day. So currently, we vaccinated 24 lakh 30,000 people in the last 24 hours. So the big news, though, is that India's 24-hour COVID cases have gone under 3 lakh with 1,96,427 cases being reported in the last 24 hours. Deaths reported are 3,511. With that, time for us to slip into a short break. More news on the other side. Stay with us. Cyclonic storm Yas is very likely to intensify into a very severe cyclonic storm as it makes landfall on the 26th of May. It would intensify further and reach northwest Bay of Bengal near North Odisha and West Bengal coast by 26th May early morning. So tomorrow it is going to be hitting the coastline there, and yet another cyclone in the Bay of Bengal. It's very likely to cross North Odisha, West Bengal coast between Paradip and Sagar Island around Balasore during noon of 26 May as a very severe cyclonic storm. Remember, this is a year after the Amphan cyclone that hit Bengal. However, this particular cyclone is not as strong as the cyclone last year. But let's go across to Manish, who joins us from Digha. Manish, tell us about the preparations that have been made and what is the weather like already choppy seas there?
See, right now we are at Digha seafront, and you can see the water, the tides are already, it started going up, and as the day progresses, although the weather is still clear, but you know that this is not the sign of normalcy, because the weather keeps changing. So it will start raining in the afternoon after 11 o'clock. The Met Department prediction is that there will be heavy rains in and around Digha also, because last year, if you remember, Gargi, the landfall was in this vicinity only. As far as preparation is concerned, because now this the entire prediction thing has really improved by leaps and bounds. So there is no let up in the preparation, because NDRF Jawans are already deployed in the all the catchment areas. Evacuation, we were talking to some district administration officers. They are saying that evacuation process will be completed by noon today. And as far as damage is concerned, of course, Chief Minister Mamata Banerjee has already said that going by the predictions by the Met Department, this year the government, the state government is expecting that there will be much more damage in comparison to last year Amphan. Gargi.
All right, Manish, we can also go across to Moni, who joins us from Kolkata. And Moni, what is the impact in Kolkata likely to be? Also, it's the second cyclone Bengal is dealing with in the time of COVID.
That's right, and there is specific instructions from the government to ensure that all hospitals in the city, in the districts, have adequate supply of oxygen, of medicines, and of course, most important, alternate power supplies. Yesterday, letters went out from the government to municipal bodies, to hospitals, to ensure that everybody has a generator and enough fuel, because who knows how this cyclone will play out. In Kolkata, the cyclone wind speeds are likely to reach a high of about 110 kilometers an hour tomorrow around noon. That's what the Met Department is telling us. Met Department is also telling us that last time round in the Amphan cyclone, Kolkata was so badly hit, particularly because Kolkata is an old city. I am right now in a very new part of it, but it's an old city with tangles of wires and huge old trees that fell and blocked everything. This time round, the state municipal corporation has gone on an overdrive, and there are some 1,000 tree cutting teams ready, waiting to deal with the aftermath. And there are 450 telecom restoration teams on standby, and also power restoration teams. A huge bandobast in place. NDRF out in the districts in Kolkata. It's the Kolkata police which has set up a unified command. But after the impact of Amphan, people are nervous over here. Not just down in downtown Kolkata, but in areas like this as well, where there are tall skyscrapers which bore the brunt of Amphan last time. Back to you.
All right, Moni, thanks so much for joining us with that. Moni and Manish, they're reporting as the cyclone is expected to hit tomorrow morning.